Most of the time, women who come in and want their breast implants removed and not replaced also have a breast lift performed at the same time. Most of the time, once these implants come out that have been in for any significant amount of time, the tissue envelopes are very stretched out and loose. So when those implants come out, the breasts look very old because they look very deflated and the skin is very loose. So in order to improve the appearance of the breasts without implants, we need to perform a breast lift at the same time. And the purpose of the breast lift or mastopexy is twofold. It will appropriately position the nipples on the chest, so we need to get the nipples to the correct location or level on the chest, as well as tighten up the loose skin. There are 3 ways to do this. One is with a donut lift or periareolar mastopexy. The other is with a circumvertical or lollipop mastopexy. And finally, the last is with a Weiss pattern or anchor-shaped mastopexy. Which mastopexy you need depends on the measurements and geometry of your breasts. It also depends on how much loose skin you are going to have once the implants are removed. So that decision is really based on measurements and combining the amount of breast tissue you have with the volume of implant inside to figure out how much loose soft tissue envelope or tissue laxity there will be once the volume of your breasts is decreased by removing the implants. One other thing we can do, in addition to performing a breast lift at the time of implant removal without replacement, is we can also perform some fat grafting. So if you want to have some volume restored once the implants are out, we can perform some liposuction to remove a little bit of fat from areas where you don't want it and graft it or inject it to the deficient areas of your breasts to try and restore some volume despite losing the implants. So for example, say you have D-cup breasts and you don't want your implants anymore. And say your implants are 400 cc's each. Well, when the implants come out, we're gonna probably need to perform a lift, probably an anchor shape or Weiss pattern lift. And at the end of that, you're probably gonna have B-cup breasts. With some fat grafting, we could at least make you a full B to C-cup breast by adding a little bit of volume back using your own fat. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.